Today's healthcare organizations must not only navigate an evolving technological landscape, but adapt to reforming payment and reimbursement systems. As healthcare transitions from fee-for-service to value-based care healthcare models, the traditional model, known as fee-for-service, simply assigns reimbursements based on what services a healthcare organization provides. But in value-based care, reimbursement is contingent upon the quality of the care provided, and it comes tethered to patient outcomes. This seemingly simple pivot of emphasis requires major changes on the part of healthcare providers. The old fee-for-service model encourages healthcare providers to fill as many beds and perform as many high-tech procedures as possible. That succeeds in driving up the cost of healthcare, but it doesn't improve patient outcomes. In this changing healthcare environment, providers must constantly assess how to enhance patient care and outcomes while endeavoring to increase revenue, lower costs, and manage risk exposure. Improving healthcare quality while controlling costs and risk requires greater patient engagement, which will lead to earlier diagnosis and improvements in preventing diseases and the onset of serious complications. Enrolling patients in a remote monitoring program and giving them the free tools to follow and reinforce their progress will encourage healthier behavior and develop healthy lifestyle habits. Providing patients and their caregivers with a remote monitoring system is a preventive healthcare measure to improve patient well-being and ultimately prevent disease, disability, and death. Clovis AI provides the tools for this greater patient engagement and caregiver intervention through a world-class remote patient monitoring platform accessible by smartphone, tablet, laptop, or the Clovis router alone. Clovis RPM enables the care team to provide automated messaging and reminders of upcoming activities, including daily medication adherence, physical fitness routines, wellness and education videos, doctor appointments, etc. Daily monitoring enables the care team to interact virtually with the patient to improve quality of life and treatment outcomes. Telemedicine is a part of an evolution of a more connected, patient-centered healthcare ecosystem. Clovis offers a user-friendly platform that not only analyzes real-time patient diagnostic data to identify trends or episodic events, but also offers unprecedented, automated patient engagement using the patient's Clovis router as the communication portal. Medical need. As the ongoing management of serious, chronic diseases impact healthcare infrastructures, new ways to solve the urgent need for cost-effective, reliable, and consistent patient monitoring have become paramount in attempting to decrease the burden healthcare organizations are currently experiencing. 75% of hospitals are being fined by Medicare because of their high readmissions rate. According to the Touchstone survey, virtual care will be one of the main deflators in an industry full of escalating healthcare costs. Projected to reach $3.207 trillion this year, roughly $10,000 per person. According to a report published by the National Health Council, generally incurable and ongoing, chronic diseases affect approximately 133 million Americans, representing more than 40% of the total population of this country. By 2024, that number is projected to grow to an estimated 157 million, with 81 million having multiple conditions. About half of all adults have a chronic condition. More and more people are living with not just one chronic illness, such as diabetes, heart disease, or depression, but with 2 or more conditions. Almost a third of the population is now living with multiple chronic conditions. In 2020, 7 out of 10 deaths in the U.S. were due to chronic diseases. Heart disease, cancer, and stroke account for more than half of all deaths each year, according to the New England Journal of Medicine. People with chronic conditions receive only 56% of recommended preventive healthcare services. A 2018 study reported that 7 chronic diseases, cancer, diabetes, hypertension, stroke, heart disease, pulmonary conditions, and mental illness, have a total impact on the economy of $1.3 trillion annually. By the year 2023, this number is projected to increase to $4.2 trillion in treatment costs and lost economic output. According to the National Center for Chronic Disease Prevention and Health Promotion, most chronic diseases are caused by key risk behaviors: tobacco use and exposure to secondhand smoke. The Clovis RPM system can help to effectively mitigate each of these detrimental behaviors. Using continuous remote patient monitoring rather than sporadic doctor's appointments, where long periods of time between doctor visits allow patients to backslide into unhealthy behavior patterns. A few years ago, in a first-of-its-kind move, Centers for Medicare and Medicaid Service made remote patient monitoring a separately reimbursable service under Medicare. Physical inactivity, excessive alcohol use. Now, CMS has proposed 3 new codes for RPM services, retitled Chronic Care Remote Physiologic Monitoring, which do a far better job reflecting how providers can more effectively and efficiently use RPM technology to monitor and manage patient care needs, including chronic care management. Medicare already offers separate reimbursement for RPM. The service is defined as the collection and interpretation of physiologic data. Example: ECG, blood pressure, glucose monitoring, digitally stored and/or transmitted by the patient and/or caregiver to the physician or other qualified healthcare professional. Qualified by education, training, licensure requiring a minimum of 20 minutes of time. CPT code 99453 performed during the office visit. Remote monitoring of physiologic parameters, example: weight, blood pressure, pulse oximetry, respiratory flow rate, and the initial setup and patient education on use of equipment. CPT code 99454 is the technical portion supplied by Clovis for remote patient monitoring that includes, example: weight, blood pressure, pulse oximetry, respiratory flow rate, initial, devices supply with daily recordings or programmed alerts transmissions throughout the month. CPT code 99454. Remote patient monitoring treatment management services, 20 minutes or more of clinical staff healthcare professional time spent with the patient on the phone and viewing the reports during each calendar month. Requiring interactive communication with the patient and caregiver during the month. RPM is not considered a Medicare telehealth service. Instead, like a physician interpretation of an electrocardiogram or radiological image that has been transmitted electronically. The interpretation of medical information without a direct interaction between the practitioner and beneficiary. As such, Medicare pays for RPM services under the same conditions as in-person physician services, with no additional requirements regarding permissible originating sites or use of the telehealth place of service code. Patients can receive RPM services in their homes. Companies currently offering chronic care management services should be particularly focused on expanding their business lines into RPM. Not only do CCM companies have current customers who can benefit from RPM services, the non-face-to-face technology and clinical integration requirements are similar. Moreover, CCM and RPM can both be separately billed for the same patient in the same month, allowing additional revenue. According to the American Medical Associations, the inclusion of the remote patient monitoring codes reflect how healthcare professionals can more effectively and efficiently use technology to connect with their patients at home and gather data for care management and coordination, while the interprofessional internet consultation codes have been added to reflect the increasing importance of using nonverbal communication technology to coordinate patient care between a consulting physician and a treating physician. A proven technology solution is urgently needed to alleviate the strain on the medical system and provide new monitoring options to patients with chronic diseases that will help mitigate the high rates of readmissions, resulting in lower costs overall and better patient care long-term. Market need. Clovis AI offers healthcare providers a telemedicine platform to monitor patient populations, thus reducing readmissions and easing concerns of emergency room utilization. A recent CDC report showed that 80% of adults between the ages of 18 to 64 who visited an emergency room during the first half of 2020 did so because they lacked access to other providers. Telemedicine also advances the legislative intent of CMS to provide evidence-based medicine and engage patients. Telemedicine, referred to as telehealth in the CMS rule, is a central element to this end. As written in CMS Final Rule, for the Medicare Shared Savings Program, accountable care organizations must define processes to promote evidence-based medicine and patient engagement, report on quality and cost measures, and coordinate care, such as through the use of telehealth, remote patient monitoring, and other such enabling technologies. Being able to engage and educate the patient is the only way to change patient behavior and accomplish the goals of healthcare organizations. However, connecting with patients outside of the office visit and providing ongoing access and transparency to care and support resources is challenging, particularly when it requires coordination between patients, physicians, clinical staff, and third-party resources. To meet consumer demands, healthcare providers need new ways to connect with patients and deliver value-added information in a cost-effective, easy-to-access and simple manner, and in a way that maintains consistency and continuity throughout the entire treatment process. Today's healthcare providers need digital solutions that are specifically custom-tailored for their businesses. The Clovis AI platform provides the right digital solutions that are incorporated strategically into a provider's business, leaving little question that Clovis AI can improve each patient's overall experience. Products. With Clovis telemedicine tools, patients can virtually engage a physician or care coordinator anytime, anywhere. They are not limited by distance or cost and time spent driving to and from appointments. Platform description. Clovis AI adopted a hub-and-spoke architecture for its platform. The central hub is a single control device that communicates with a heterogeneous collection of endpoint devices into a functional team irrespective of what protocols or connectivity options a particular device uses. The platform provides the coordination intelligence and allows seamless access to a broad range of services at home, thus providing consumers with some degree of choice in what devices from various vendors they can add to the network. The Clovis router can stand on its own and transmit data collected through the embedded SIM card. Patients can view their diagnostic data on their PC, tablets, and mobile phones as soon as the measurement is taken. The system will also send notifications to the care team if the readings are not normal. System details. A team of engineers financed by HME Technology Incorporated developed the Clovis router and content. Highlights of the system and content are: automated coaching. We designed the Clovis platform with automated messaging capabilities that enable case managers to leverage technology in their delivery and access to healthcare. Most episodic events go unnoticed or not addressed simply because there are more pressing or higher cost scenarios monopolizing their resources and attention. Case managers can create their own automated triage of events, which not only enables them to deliver consistent messaging with documented read receipts from the patient, but allows them to view the patient stats based on exception, even when it is something minor. This provides case managers latitude to focus on more severe situations and events that warrant their personal touch. Patient reward. Modifying patient behavior is challenging, but maintaining the patient's motivation and keeping them engaged over time may be even more difficult. Gamification is a term used to reward someone for performing a chore. Clovis AI has gamification technology built into the architecture and enables any healthcare organization to create a myriad of rewards to offer to their patients for adherence to their prescribed treatment plan. We can divide each population into subgroups that are driven by different rewards, whether it is monetary, entertainment, gifts, and the like. Gamification is pinnacle to keeping patients engaged and having a successful population health management program. Connected diagnostic devices. Clovis AI-approved diagnostic devices have kept pace with scientific and technological advancement. We incorporate all the diagnostic devices with the ability to connect out of the box to the router and transfer biometric data collected. Patient Health Management System. The Clovis AI Patient Health Management System is the backbone of the Routers platform. It offers healthcare providers the ability to develop personalized programs that aid the patient in monitoring their health and forming positive health habits. Each program is comprised of intervention strategies that improve patient adherence and increase the clinical benefits of doctor-prescribed therapies. In addition, Clovis AI Patient Health Management System generates all the reports and analytics that are required by the healthcare professionals. It allows the healthcare professional to customize reports and schedule them for printed, faxed, or digital transmission and storage. The system provides instantaneous vital sign feedback, health coaching with virtual visits, and patient rewards, all of which encourage the patient to remain engaged in the management of their health. The system also allows patient access, whereby patients can update their contact information, review reports, search for notes, and add notes. More importantly, patients can review their logbook settings and amend their daily schedule. Further, patients can customize how they would like to view reports by selecting the time frame to view reports, such as last 30 days or last 14 days. They can also select multiple reports to add to their on-demand reports. The Clovis AI Patient Health Management System makes it easier for the patient and their healthcare team to stay up to date on the patient's current status, with the software ability to create a 5-star rating for the patient and the doctor. The star rating capability embraces Medicare's current structure used today that determines how much a doctor is reimbursed based on their star rating. Competition. As with any industry, there is competition in the telemedicine arena. According to mHealth Intelligence, telemedicine technology first began as a form of healthcare delivery in the late 1960s, due to the needs of the National Aeronautics and Space Administration. Throughout the last 50 years, there have been multiple barriers standing in the way of widespread adoption of telemedicine technology and remote monitoring tools. Financial, regulatory, and technological challenges made it more difficult to advance telehealth adoption. But current healthcare reforms may bring about a change in this arena. The lack of broadband infrastructure has proven challenging for the advancement of many forms of telemedicine, specifically high-demand video and store and forward services, which require expansive health networks, the research paper stated. Full suite of products. Clovis is an all-in-one system which connects to a full suite of products. The caregiver may order for each patient's specific medical condition. Caregivers can add or remove diagnostic devices and capabilities as the changing medical need requires. Future-proof. The Clovis RPM system will connect, pair with, and accept most medical diagnostic devices and other technology available now and in the foreseeable future. Clinical and non-clinical. The Clovis design also provides the clinician and patient with non-clinical information. The system can accept other IoT devices, such as motion sensors and electronic light switches, which may reinforce healthy behaviors and add conveniences important to the patient's lifestyle. Price point. Management's long-established relationships with manufacturers in Asia and years of experience in the medical device industry have contributed to the well-positioned moderate price point of the Clovis RPM system. Flexible open source. The Clovis RPM system easily connects and interacts with other devices using universal open source planning. The primary competitors and their telemedicine systems are Philips, IntelliView, Honeywell, LifeStream, McKesson, HomeCare, Vivify, Pathways Plus Home. There are other companies in the market, but only the Clovis platform provides all the competitive advantages described above. Target markets. Clovis plans to target the United States and international RPM markets via 3 primary distribution channels. Payer-patient management groups. These represent organizations responsible for managing chronic care patients on a capitation basis. These organizations need ways to cost-effectively and efficiently care for the patient in order to maintain profitability. Direct to doctor. Clovis is contracting with organizations to sell its RPM platform directly to physicians on a wholesale basis, allowing the physicians to use their existing fee-for-service billing codes for remote patient care. International. Many international health systems and institutions are not yet prepared to implement the use of the entire Clovis platform but do need improved diabetes management. Therefore, the company will assist international partners in setting up the server in their country. The SIM card built into the router will accommodate most of the world's cellular transmission sites. In the United States, the company has agreements with several early adopter caregivers, such as Georgia Physician Group, Test and Share, Heath Observation Platform, Pinnacle RX, Anderson Health. Corporate structure. Clovis AI LLC was formed in the state of South Carolina on May 2, 2022, under the Uniform Limited Liability Company Act of 1996. The offering. Clovis AI is seeking an equity investment of $1 million to be used for inventory and operating capital. The funds will be used as follows. Purchase of initial inventory required until cash flow can self-fund inventory purchases. Increase staffing in the sales, operations and management areas. General and administrative expenditures to operate the company. Summary of the offering. The following material is intended to summarize information contained elsewhere in this limited offering memorandum. This summary is qualified in its entirety by express reference to this memorandum and the materials referred to and contained herein. Each prospective subscriber should carefully review the entire memorandum and all materials referred to herein, and conduct his or her own due diligence before subscribing for member units.